Today, Chloe and I are going to talk with Nick Hanna. Nick is a physical therapist, physiotherapist in London, Ontario, in Canada. And we talk about communication as the next frontier in rehabilitation and working with clients who have chronic pain. And I think you're going to get a lot out of today's conversation with Nick Hanna. Hey, Chloe.
Hey, Raph.
Hey, Nick.
Hey, Raph.
Awesome to see you.
Yeah, it's been years.
Yeah.
Yeah, when was the last time you two talked? It was literally years, right? Maybe 2
years?
It
was like 2018, 2019, something like that. Yeah.
Bet some moves have happened since then, Nick Hanna.
I've grown up so much.
Yeah. So, Nick, I can't tell you how much Chloe's been messaging me about how excited she is to talk with you.
Calm it down, Raph. No, I think more how this went was Nick's gonna come on our podcast and basically pay the shit out of me for an hour and tell everyone how much he loves cat web more than me, right? Right, Nick? Let's just get it out of the way. If we get it out up front, it's out of the way.
I have there's a long-standing inside joke among myself and Chloe where I just kind of shit on her and tell her that I think cat web is the bee's knees with Pilates in Australia, and I think she's way better than Chloe, and it's just a lot of fun.
This is how
Shout out to Cat Web.
Nick's and my friendship has developed over the last 5 years or so.
Yeah, if Chloe isn't giving me the finger when I'm chatting with her, then I'm doing something wrong.
So, Nick,
So true. So true.
can you start out by, rather than us doing this big kind of wind-up introduction for you, could you just start out by sharing with the listeners, like, who you are, a little bit about your backstory and how you define what it is that you do these days?
Sure, yeah. I'm a physiotherapist in Canada, for those of you in the Antipodes who don't, it's far away from you guys. So my backstory, I don't want to get bogged down with kind of my schooling and all that, but I knew I wanted to become a physiotherapist way back in high school, and I just kind of it had to do with me seeing physiotherapists work with my grandpa, and that was like a neuro rehab setting, so totally different from what I do now. I work in more of an outpatient orthopedic clinical setting now, so I see just people who hurt generally who walk through my door, and I think what my role is as a physiotherapist and just more broadly as a health professional is I'm trying to assist my clientele in finding insights for change. So really I'm this architect of change, because I think at the heart of what allied health professions are doing are related to behavior change at its soul and at its core. So I think my role is to help people find just opportunities in their lives to get from where they are now to where they want to go. And I'm helping to clarify where that direction might be. And then I'm that coach. I'm that person in their corner who's helping them see for themselves what they're capable of, and then showing them a little bit of the way, but hopefully eventually they can kind of lead on themselves and they don't need me anymore. So if that's different from any preconceived notions of what a physiotherapist does or is, then I'm happy to chat about it. But that's what I just
want a massage, bro. Like,
yeah.
No, so in all seriousness, I think it might be a bit different than what a lot of people assume a physiotherapist does, or a physical therapist, as they're called in the US. That, I guess a lot of people would assume that, the treatment they would get from a physiotherapist would be like specific exercises to correct their posture or activate their muscles properly, or maybe, massage or manipulation or stretching or, TENS maybe, or taping, all of that kind of stuff. But you didn't really mention any of that. You said communication, coaching, seeing possibilities, co-creating the future. So can you talk about that difference?
Yeah, I think what you're getting at is how, and it really relates to how most physiotherapists are just sort of domesticated into practice, like our schooling and our whole essence and a lot of the educational system still, and it's evolving some, which is nice to see, but they very much groom us to be these quote unquote like fixers and to have a fixer mentality coming out of school. And I was like this. I was very much like a technician. You hurt, you come see me. I'm diagnosing why you hurt. I'm applying my skill set onto you. Like I'm doing things to you to make you feel better. And we do that for a little bit of time, and then you're all good to go, and away you go. But what I realize is that, while some of those things you mentioned may be little pieces of the puzzle for a rehabilitation program, sometimes it's okay to create some sort of pain modulation or some sort of give somebody relief, particularly if they're suffering or having a rough go with it. Like I certainly have no problem with those things you mentioned, but as part of the grander whole of rehabilitation, change often happens over a longer period of time, and often not on my time. And I call back to this message that I often give my clients, that they're with me for such finite time in their week that the time we spend together should be very much fruitful of education, planning for how they can implement things in their time, because 99% of their life is not with me. And so knowing that, I very much spend a lot of my rehabilitative process now focusing on the how of rehabilitation, not the what I'm doing. It's okay to do certain techniques, but rehabilitation should be with people, not to people. And that little click, that little shift in perspective is very much what led me into this more of a coaching role where, again, helping people find insights for change, helping people plan accordingly, helping them understand what it actually takes to change where they are now, and line that up with what their expectations are, what their wants for rehabilitation are, and then coming to agreements to that. And it's very much an art. It's very much an art form. And yeah, I'm not going back.
What you say there, I just want to unpack that a little bit. Sorry, Chloe, if that's all right. You talked about being an agent for change and a facilitator and a coach, and that change happens over time. And all of that, underneath all of that, to me, is the implication that it's the client. Is they're the one doing the changing. And whereas I guess the implication under the model, where you as the physiotherapist do stuff to the client, is that you're the one making the changes. They're just the passive recipient of the treatment, of the change, of the whatever. You make the decisions, you're steering the ship, your foot's on the accelerator and the brake. Whereas, so you're positioning yourself as a guide, a coach, a partner, but the client's making change. But so can you just talk us through just a little bit of the nuts and bolts of that? So if the client comes in and they need to activate XYZ muscles more, how are they going to do that? Don't you need to help them with that?
And by the way, he did activate in air quotes.
Yeah, there's air quotes.
Yeah, Raph, you that came out way too deadpan for the air
too
quotes
deadpan.
to be assumed.
Okay.
Yeah, getting at the nuts and bolts of the process. Well, I hear people talk about models for how they roll out care being patient-centered or client-centered, and I actually I actually don't necessarily buy into that model entirely. I operate more from a relationship-centered model of care, meaning there are two people, involved in a rehabilitative process. So, what you were talking about in that fixer-oriented model, that's more like doctor-centered or like clinician-centered. Like, let's do everything that I want. And it just doesn't make sense because it's not me with the problem, right? So, I'll echo back to the whole differentiating of time. Like, most of your time is without me. So I operate very relationship centered, meaning there's two people. We both come with our own sets of experiences, our own sets of knowledge, our own sets of biases, and therefore we should both be contributing to the rehabilitative process. Yes, I very much have a depth of knowledge of, pain neuroscience, biomechanics, neurophysiology, biology, all these things, but I don't understand your life the way that you do. And so we both need to be co-creative and collaborative in our efforts to design a program that fits with your lifestyle, which you know about, but implements expertise or movement strategies or muscle activation strategies that I might bring to the table. And then having a discussion for what our touch points need to be and what our sessions need to involve. And that's going to be different for different people. And that's what I love about my job. It's always a different subset of circumstances, and every rehabilitation session will look different depending on the needs of that person in that moment, on that day. And it's just the nature of life that shit happens. And by having more fluidity to the way you approach your care, meeting the person where they're at in that day, then you can respond to the needs of that person more effectively in that moment, instead of the preconceived sort of cookie cutter, this is what we're going to do, lay down, I got you, let me rub it out today, no big deal. So it needs to be more collaborative.
So I'd love to know, and I mean, for those that don't know Nick already, Hannah Moves on Instagram is, you've been putting out some solid content there for years now. I mean, I think that's probably how I first stumbled across you. And is your brother still doing the graphic design?
Hell yeah. I'm no G in that regard.
Yeah,
Hashtag Zach Hanna.
Zach's work's awesome. So the crux of what you're talking about here really is coming down to communication and building a therapeutic alliance. And I know that what I hear from a lot of our grads, and particularly those that are working in more of a clinical setting, or with clients with persisting pain, is the client, the low self-efficacy client, for want of a better word, the client who's like, I've had enough of this. I need someone just to fix it for me. I'm not feeling heard. I'm not feeling all of these things. Fix it for me. How do you work? Because what are some tips on how to build self-efficacy in the class? Like, what do you do in regards to that setting, the communication? What are some ways? Because I'm assuming you've got different communication techniques depending on the client that's presenting in front of you and the individual human, and you'll have the client that's like, hell yeah, I'm so ready to, like, let's just go, whatever you give me, I'm going to do it, and I'm going to religiously do those exercises that you give me at home, and etc. And then you've got the client that is like coming in going, I know I need you to adjust my back, or I need you to I need you to fix this pain.
Yeah, it's not, again, it's not an easy answer like that.
Yeah, no, I don't expect it to be
You're
easy.
asking the hard. You're asking the hard question, but so, I mean, yeah, building self-efficacy is a hell of a beast when you're, given what you've just said. Like, if we are considering a person who's, living with persistent pain, not living well, like not having a good go of it.
Yeah.
They're oftentimes people with complex pain presentations that are persisting often have very complex lives and a lot going on. Like, it's not always the case, but generally speaking, complex presentations often come from complex lives and histories. So when you see a person like that and they're just despairing and hopeless and just they can't see a way forward, I mean, it has to start with listening and just letting them explain their situation, explain their frustrations, and then echoing those things back to them, like really using, hopefully this isn't going to confuse your audience, but like cognitive empathy skills, which is the ability to put yourself in their shoes. So, but hearing their full experience, and emotional empathy is when you take on the experience and the feelings of another. So why it's useful is you can actually experience in your own body what they're going through in that moment. And so it helps you better understand their circumstances. But I'm going to give one example of something I do, Cloe, like just because for people who see no capacity for change and that they are just like, forget it, like there's no point to even trying. What I usually help them understand in terms of understanding a process for change is think of something in your life that you are already very much an expert in, like something that maybe you went to school for, or you have a career in, or maybe it's a hobby of interest. And then I ask, like, what did it take? What did it take for you to get to that level? And what it does then is it gets them very much in a forward-thinking sort of, puts them in the driver's seat, puts them in a creative thinking mode, helping them understand that, okay, this actually was a lot of work. Not only was it a lot of work, it was a lot of work over a long period of time. I probably went through some failures. I learned from my mistakes. I got back on the horse. I tried again. I failed again. I put the reps in. I maybe asked other people for help. And so I talked to them about things that they know themselves to be part of their lived experience, that they have experience with. And then I just reframe it and I'd say, well, why don't we apply those same principles, those same set of circumstances, and that same orientation to this challenge that we're facing? How is that any different? Like how could we, and it's very quickly, then it gets them away from everything that's fucking wrong, and puts them in a creative, solution-oriented thinking mode, which is what rehabilitation needs. Like, change is hard.
Change is really hard. Change is really hard. It's really hard. Like, it's really, really fucking hard. I love that. That's awesome. The reconceptualizing of it. It's awesome.
Can I just ask here for a bit more of unpacking of this idea of change? Because I'm just imagining, again, I'm trying to put myself in the shoes of many of our listeners, because they're and they would expect, okay, I'm going along to see Nick because I've got a sore back. Nick's going to massage me, strengthen my back, stretch me out, whatever. And you're talking about change. Like, what am I going to change? Like, what change are we talking about?
Yeah, I guess I'm referring to just the change from the sort of distressing, unpleasant, uncomfortable circumstance of living with pain or some other musculoskeletal complaint, and getting away from that, like changing that circumstance. Like, that's really what I'm getting at. And do you want to further pick away at that? Because I'll riff if you want me to riff.
Yeah,
I want you to riff.
Yeah, riff. And I want you to throw in a bit more around. You were talking about cognitive empathy. I want you to give us a bit more insight into that too.
Yeah, I can talk about empathy. So, I sort of dichotomize empathy into each, which is, I sort of touched on earlier, how it's the taking on of another's emotional experience. And this is something that happens automatically and unconsciously particularly in a very compassionate, caring setting. And so it's really, truly taking on the feelings of another person. And where it's slightly different from cognitive empathy, which is cognitive empathy is very much a deliberate skill, and it's something you need to practice, and it's this, in essence, just putting yourself in another person's shoes. And I think both emotional and cognitive empathy are important in any healthcare movement, practice, rehabilitative scene, because I love emotional empathy because it just enhances my listening skills beyond anything that I could have ever believed. Because if it's something that happens automatically and I feel and I take on the emotions that another person is feeling in that moment, it's so easy then to just reflect that back on them in a form of active listening, where I'm just saying, like, that it just sounds like heart-wrenching, like what you're going through. I'm just literally expressing what I'm feeling. And whereas cognitive empathy really is what leads us into true compassion, I think. Like, that cognitive empathy skill set is the gate towards truly caring for another person. Like, if you take on and do your best to put yourself in their experience, in their shoes, it's really hard to not give a shit then.
Geez, you totally skipped all of that with yours and my friendship. I haven't seen a lot of that sliding into my DMs, but whatevs.
I have a level of that I get to where if I'm being a real prick and asshole to you,
it means
on a regular basis, that means I really value our friendship and our relationship.
Okay. Good.
So
Good to
so
know.
you're
Okay,
on another level. Yeah.
Thanks, Nick. I feel better now. Right. So empathy is interesting because I've been having and we're going to have an episode with my dad. My father, up until retiring this year, worked with, he's a family relationships counsellor working with a lot of clients with drug and alcohol, substance abuse and physical abuse, etc., from institutionalised care from when they were young. So working with a lot of clients who are just, as he would say, just have no hope, like they are feeling hopeless. And he was talking about a model, I'm not sure if you're aware of this, about potentially, he was talking about the difference between empathy and compassion, and that they're kind of two separate things, and that for empathy, you need to be able to imagine yourself in the same situation as that person to truly show empathy, whereas compassion you can have for everyone, whether you can imagine being in their shoes or not, you can show compassion to that person. So I'm wondering if you've sort of, for me, I find, I think I am a highly empathetic person. And I think when we're talking about things and I'm hearing, heavy conversations, or someone who is, feeling hopeless or in distress from their situation, me personally, and in a professional setting in particular, I think because I am so sensitive to things like that, I've found that to truly step into that and putting my feet in their shoes is too heavy going for me. Does that make sense? Like, it's hard. Like, do you know what I mean? How do you put yourself in someone's shoes who is in distress, who is feeling hopeless, who is, having a really shitty time in life? And we know when we do the big listen with our clients that we will hear some heavy stuff. If you just sit there and you say, hey, tell me your story, what's going on for you, and you shut the fuck up and you listen, they're gonna go there with potentially some really heavy stuff. So I've also had this not only in my own experience, but also hearing this from students and grads who are working in a clinical setting with clients who are feeling hopeless and in heavy situations. How do you protect how do you protect yourself in that, right? How do you not let that, and Pilates instructors, as I'm sure physiotherapists as well, Pilates instructors tend to be, and particularly those who want to go in to work with clients who are in pain, etc., and want to help get them out of that, tend to be really, and I'm sure you can back me up on this, Raph, they tend to be a certain sort of person that is empathetic, just naturally, is sensitive, deeply, deeply cares. And they're like, fuck, how do I like unpack this? How do I not then bring this into the rest of my day, into when I go home and I'm with my family? How do I not let it psychologically affect me and how I'm showing up? I know that's really big. And
yeah, no. I'm happy you brought it up. Like, it's a huge, it's such an important topic, actually. And
awesome.
I would say that I'm as a naturally, I'm not like hyper empathetic. Maybe as empathetic as you described. Maybe that's why I'm an asshole to you all the time. So I just don't care. No, but the yeah. So I'm a sociopath deep down. I just don't care. But so what you described mostly there, when you say when you're taking it on, like that's emotional empathy. And so what I do personally it's like a zooming in and zooming out effect. Like, so I use emotional empathy again to reflect the feelings back on them, so I know that I've actually or accurately captured what they're feeling. But then even it's being able to have the skill set to perspective take, put yourself in their shoes, and then feel and be with them in that moment. But then zoom out, like you can't get pulled into that, because it can very easily just be like this emotional overwhelm, and like some people are just full of like horrible, terrible, tragic stories, and but amazing just in how they can get through the day, and like just these unbelievable stories of resiliency. But the trick is to then pull yourself back out, because then it's like, okay, I was there, I get it. This sucks. Now let's plan. Like, what can we do? Like, and that's how I reconcile and not get pulled too deeply into what emotional empathy can do. Because if you're just sitting there and you're like, oh God, like it's horrible, but then you can get stuck in it and very much feel like we're not going to get anywhere. So what I do professionally is it's like this zoom in, zoom out effect, and then I'm back out, and it's like, okay, I get that. Now, where are entry points for change? What are the low hanging fruit? What can we do? Because you're not going to solve all the world's problems, and that's okay. Like, let's pick something that you and I can agree on, and let's tackle that. Let's build a little bit of momentum there, because that's what change is. Like, big change is just small change over and over. Like, get the little things done, show that you can do them, and then let's tackle the next, and then the next. But yeah, I agree. Like, you especially people who are very hyper empathetic, like they can get just like bulldozed energetically throughout the day, and they go home and they're like, holy shit, maybe I'd be better off just working real estate or something. Like, maybe a different career is good. But and we could even talk about that, but having boundaries and taking care of yourself is critical to being a health professional or any movement professional dealing with people who are having a rough go of it.
I think, like what you say there about zooming in and zooming out, and having boundaries, is so important. It's equally important to be able to put yourself in someone's shoes and to understand their experience, as it is to be able to actually get out of their shoes and observe their experience from the outside, from your own perspective, and go, I don't have to live there. I don't have to live in their shoes. I'm just visiting.
That's right. And that it speaks to just the relationship centeredness, right? Like, you're not just taking on everything that is them. Like you have to bring your own lived knowledge, experience, and skill set to them as well. Like they are coming to you for a reason. Like we are experts. Some of us more than others.
So, all right. So, can you give us an example of what, you said, agree on something that or, something that you can do or that they can do that you both agree on. So can you give me an example of what like a plan might look like for somebody at the, in the early stages of, dealing with chronic low back pain, for example? Like what sorts of things will they go off and do?
Yeah, it's hard because a lot of people come in like wanting, like, I just want the pain gone. And I understand that, and it's unpleasant. And what that doesn't necessarily serve is the necessary ingredients that'll drive intrinsic motivation to actually do things to change. And just what I mean by that is we need to clarify there needs to be something that this pain is getting in the way of or affecting that we can tangibly work on. And I am a physical therapist. I work on physical stuff. And so often what my skill set lends itself best to are, pain limiting things that you would like to get back to doing that perhaps you aren't doing now. And so I will very much sit down with somebody and have a conversation about what that thing is, and make it very clear that yes, pain management and pain improvement is part of a rehabilitative process, but we need a North Star. Like we need something that you are focused on that we can come back to, because if pain gets worse or things flare up and you start to doubt and you think, oh, this isn't working, what are we doing? If you lose sight of that North Star, then we lose sight of the entire essence of what I think my job is. And so then it can just get muddled, and then people very much fall into like, well, just do something to make it feel better. And, I sometimes feel that pressure where I'm like maybe not. Like it's hard to make that decision. But so really I sort of dissect, okay, people put up with pain for a shit ton of time before they choose to go see a professional. It's like, okay, so something has happened in your life that has served as like some sort of mirror where you look up at yourself and you're like, fuck, I got to do something about this. Like this is getting to be too much, or it's taking away something. And I want to know what that something is, because that is exactly what I want our focus to be for the entire rehab process. And I am going to bring it up every single time you see me, because if it's important to you, and it really has to be something that's truly important and truly purposeful to them, then it makes a rehab process far more likely to stick to. And I want to clarify, this is far away different from dealing with somebody who's at maybe an acute episode of back pain, let's say, where it's like, well, I mean, shit, most often you're going to get better. Like 2 to 8 weeks, you'll be fine, generally speaking. Yeah. Let's rule out some bad stuff. I'll give you some general advice. So again, my approach is different from a persistent basis versus like an acute basis. I just felt the need to clarify that, because people will be like, well, what the fuck? Like, this guy's digging away at like purpose in life when I just like was tying tying my shoe and my back hurts now, and this guy's like,
we need to talk about change.
I think that this kind of there's a really important kind of paradox, I think, to just draw out there, which is around, when people come to you, and probably when they come to Pilates as well, if they have pain, whether it's in their low back or any other part, if that's what's motivated them to come along, well, one of their really important goals is, I want to get out of pain. I'm sick of this pain. And like you said, that remains a very important part of any rehabilitative process. But the reality is, it's not wholly within our control. Medicine, science currently doesn't have the tools to perfectly solve pain for everyone or even most people. And so, yes, we've got a few little gimmicks and gewgaws that we can use to temporarily, reduce your pain. We can, massage, we can stretch, we can use heat, we can use exercise, we can use meditation and mindfulness and cognitive behavioural therapy. There's a few little tools, but none of them are spectacularly effective. And even when you combine all of them, they're only like slightly better than any one of them by themselves. So really, yes, pain management and pain reduction is important. It's super important to our clients, and we should never disregard it. But it's like, we can't promise them the moon in that regard. And is that why you think it's important to focus on actually getting them back to their valued activities and the things that are that pain is getting in the way of, and the reason what triggered them to come in, the mirror?
Absolutely, yeah. This just the complexity of the pain experience, right, is so beyond our full understanding, and we keep peeling back layers and layers and layers, but it's this dynamic emergence, perhaps, of this dynamic interactive process where maybe it's related to real or perceived threats. Like, maybe that's a good, decent model that we have, but the more we
it's the least worst model we've got.
Yeah, the least worst model, yeah. And we could talk about inactivism and biopsychosocialism and all these like crazy models that have been applied to pain, but at the end of the day, you're absolutely right. I can't predict whether or not pain's going to improve in the long haul. And I think it's far more important that we focus on something that I know we can improve. Like, I know we can change function. I know I can help you improve your overall activity level and resiliency and tolerance for activity with or without pain, or despite pain. And I can help you live well with pain at certain times. And again, go ahead.
The emotional salience of it and the suffering is a separate entity to the physical sensation, to the bodily sensation. And I know that from my own personal experience. Probably 20 years ago, I had an injury to my right eye socket. I fractured my eye socket, and one of the muscles, the inferior rectus muscle, in fact, the muscle underneath the eyeball that helps you look downwards, pulls the eyeball so you look downwards, it herniated down into the fracture. So basically, the bottom of my orbital bone, my eye socket, fractured, and the muscle got stuck down in there. And so I had a plate put in my eye socket, general anaesthetic. And I woke up from the general anaesthetic, and I had this sensation in the right side of my face. What I later found out was down the path of the trigeminal nerve. But it's basically, if you've ever been to the dentist and you've had one of your upper teeth, dentisted on, they give you an injection in your upper jaw somewhere, and it makes the whole side of your face blow up, feel like it's blown up like a balloon, and all tingly and weird, feel like you can't talk properly. Well, that's what I felt like when I woke up, because they anaesthetised the same nerve. And I was like, oh, that's weird. They must have given me a local anaesthetic and it hasn't worn off yet. And I didn't think, because I was a bit out of it, I didn't think like, oh, well, why would they give me a local anaesthetic when I'm under general anaesthetic? This is the ramblings of a semi-conscious brain. But, the next day, so I didn't say anything to the hospital staff. The next day it was still there, and I'm like, that's really weird. And so I said to the nurse, did you give me a local anaesthetic? And she was like, what are you talking about? You were under general. And later, when I eventually went to the follow-up with my surgeon a few weeks later, it was still there. And I said to the surgeon, I've got this weird feeling. He's like, oh yeah, we must have nicked the trigeminal nerve. And I'm like, oh, well, how long will that, until that goes away? And he said, oh, probably never. Oh. And I'm like, what the fuck?
Whoa.
You know? And because that was, you know, I mean, if you've ever been to the dentist, it's really fucking unpleasant.
Yeah.
You know, for the hour afterwards when you're walking around going, I can't feel my fucking face.
Yeah.
And I was like, if I have to put up with this shit for the next 20, 50, 80, whatever years, like that's going to be bloody horrible. I can't touch my face. It's physically repulsive to me to have that part of my face. I can't even touch it with a feather.
Wow.
You know, if I kiss my wife, I have to kiss her on the other side so my nose doesn't touch her nose on that side. Like it really, you know, shaving's really incredibly uncomfortable on there. But when you look at it on the outside, it just looks normal.
So wait, so Raph, you've still got it now? What?
Yeah, and well, the other thing was that so the trigeminal nerve feeds all the way down from your eye, down sort of the side of your nose and sort of half of your, you know, upper lip, and then down into your cheek here. I know because I'm tracing the outlines where I feel that horrible sensation. So I had this I had this sensation that the right side of my nose was running, right? And I checked and it wasn't, and that was weird because I could feel my nose running, and to this day I still feel my nose running like 24 hours a day, and so that's why I always carry a hanky with me, and I wipe my nose because sometimes it is running. Right, but I can't tell the difference because it always feels like it is, and I've still got this totally weird sensation in my face, like I just woke up from the dentist. You know, I just had my tooth extracted or something like 5 minutes ago, and my face is, you know, blown up like a puffer fish. But you know what? For the first, you know, 3 or 4 months after the doctor told me like, yeah, no, it's not going to get any better, I was really despondent. You know, and I was like, this is fucked. You know, I don't want to live like this. Fucking hell.
Yeah.
You know, and then I went through, you know, looking up Google, is there anything I can do about this? And the answer was no. You just have to wait and see, and some small percentage of it will probably fix itself, but most of it not. And, you know, lo and behold, 18 months later, it's still the same. And now it's 20 years later and it's still the same. But you know what? Like, and so, you know, I've made some adjustments. Like I carry a hanky with me. I always kiss my wife on, you know, the left side of my nose. You know, so there are a few things, you know, physical things that I have to do a little bit differently there. And I just shave quickly, you know. But, you know, from 1 week to the next, I don't even notice it anymore. You know, I never think about it. It's just, I mean, physically, if I can still, you know, eke me out, but it's emotionally, it's not a thing. You know, I don't give a shit about it anymore. Whatever, you know. Like if you said to me you could wave a magic wand and give me back sensation on the right side of my face, I'd be like, oh, that'd be cool. But it's like if you said, oh, what are your 10, you know, most important wishes in the world? I wouldn't even think of it. I'd think, you know, world peace, time travel, flying, invisibility, you know, but I wouldn't even think about could I have the sensation back, and it wouldn't even enter my mind, you know. So the you know, so I see that as a successful rehabilitation process, even though the I don't have pain, but the unpleasant physical sensation is still, you know, 100% there. It's like I just don't give a shit about it anymore. It's not a thing.
Wow. What a story.
That's amazing. I remember you've spoken before about that, and I didn't put 2 and 2 that side of your face was still. I remember you've told me about your nose before, but I didn't realize that meant half of your face you couldn't.
It's only like, it's that much. It's maybe like a quarter of my face. Yeah, just my right, the medial part of my right cheek, my right side of my nose, upper lip.
It's amazing, Raph. Wow.
My eye a little bit. Yeah.
Cool story.
Anyway, so I think that's what you're talking about, right, Nick, is like we can't guarantee to take away the pain.
Yeah. So I am talking about that, yeah.
Yeah. We can't guarantee to take away the pain. Maybe we will. Maybe we will a little bit. Maybe we'll make no difference to the pain whatsoever. And, you know, there are some things that we can try, but we can't guarantee any degree of success. But we can guarantee, well, not maybe guarantee, but we can have a lot of control over helping you get back to doing, you know, living a full life and engaging with the things that are important to you in a meaningful way and getting satisfaction and joy from life despite, and not caring about the pain.
Yeah, like I what I'm thinking of, Raph, is I can only imagine if you would have chosen to continue to seek out and search for ways to fix and change this, like where would you be now compared to what sounds like has been, yeah, an obvious degree of acceptance, a kind of like, fuck it, whatever, like carry on, and among I'm sure a bunch of other, like, you know, just mindset and like mental rehab, that just goes to show like how, wow, that's a hell of a story, man. Yeah, I was not ready for that.
Raph, how did you? I'm still. This story is amazing, Raph. So you said there was like 18 months where you were, or no, not 18 months. There was a certain amount of time where you felt really despondent about it and really, you know, like this is fucked. This is not how, you know, how am I going to go on with this forever? What was the change? Like how, you know, so you're searching for a fix. You're doing all of these things. How did you like what happened?
Well, I didn't search for a fix a lot. You know, the surgeon said, look, you know, we must have nicked the nerve. It sometimes happens. It's really hard to avoid. You know, if you look closely at the fine print I showed you before the operation, that was one of the things I said.
You've actually wavered that. Soz.
Although I don't fucking remember because it was, you know, anyway.
Sounds like you weren't in the best place if you're going in for that procedure anyway, but yeah.
Like, I think, like, he told me, like, it might, you know, whatever degree of regrowth of the nerve is going to happen over the next 12 months, you know, and it might be somewhere between 0 and 100%, probably closer to 0, you know. Actually, he didn't say that. He said the impression I took away, and this may or may not have been what he actually said, but what I took away from that meeting was like, oh, it'll grow back in 12 months.
All right.
And so for 12 months, I was like, oh, awesome. You know, when's it going to grow back? And then it's like, it's 11 months and 28 days. And I'm thinking, hold on a sec, you know, when's this supposed to happen? Like, you know, we're getting close to the deadline here. And, you know, so, you know, I'm sort of massaging it and, you know, doing this kind of, and you know, then I went back to him like at 18 months and I was like, you know, it's still the fucking same. And he's like, oh yeah, I guess that's what you've got to live with now. And I'm like, what do you mean that's what I've got to live with?
Did he deliver it like that too? Really just like, sorry, too bad, too sad?
Again, like this, you know, I'm 50 now. This would have been when I was in my mid-20s or something like that. So it's like I can't remember the nuance of how he delivered the information. I'm sorry. But I don't remember him being incredibly empathic. Let's put it that way. But I think, you know, I don't know. I didn't go through any cognitive therapy or self-help books or acceptance or meditation. I just gradually just lost interest in it and forgot about it. It's like I've got absolutely no control over this. So why?
Yeah.
You know, it's just like, well, what can I do? Sitting and thinking about it's not going to help. So just get on with life. You know, wipe your nose, make sure you got plenty of hankies cleaning the drawer, and you know, keep calm and carry on. It's like
there's a lot of wisdom in just that. Like that's so important.
But I think that, you know, a lot of people, I don't see this as a particularly extraordinary process. I mean, a lot of people live with pain and you know, other physical symptoms long term without it really affecting their quality of life, you know. And I think I don't think anything I did was consciously designed. It's just like my brain was like, okay, I'm not going to pay attention to that sensation anymore because it's like this background thing that's always there. So you just ignore it. It's like, you know, if you live across the road from the train line, you don't hear the trains after a while.
Yeah, it's so true.
So anyway, sorry.
Thanks for sharing that story, Raph.
Went off on this side tangent, but I think, you know, that's why I brought that up is because, Nick, of what you said about, you know, function and return to meaning, to engaging with life and you know, engaging in meaningful activities being a much more valuable focus of rehabilitation than solely symptom reduction. Although, clients are freaking highly motivated by symptom reduction, and we can't disregard that. But we also, honestly, it's not within our power to guarantee that, right? So we have to be humble enough to go, you know what, I'll do my best, but we may or may not succeed in that area. So what's a more important goal that we can actually influence?
And it's hard to navigate that conversation and that communication, because if you just flat out say that, sometimes some people are going to be like, well,
what's the good of you then?
Peace out, bro.
Yeah.
I'm going down the road. I'm going down the road where they can tell me they can fix me.
That guy down the road, that guy down the road, he's going to fix me for sure. Yeah, he promises and guarantees it.
Sooner or later, I think people will have to confront that that sometimes many of the circumstances and factors that may be driving an experience to persist might be out of your control. And I think when faced with those circumstances, the acceptance of that, and then the kind of, gotta carry on. Like, it's outside of my power of control, and so now what? Like, okay, carry on. And sooner or later, people, I think, have to find that out for themselves, whether it's have somebody tell them or they discover it. Like, there's a lot of suffering, I think, that happens when trying to constantly amend a symptom, like trying to constantly find that quote unquote fix. There's so much distress that and suffering that doesn't need to continue necessarily.
Yeah, we talked with Bronnie Lennox Thompson last week or the week before, and that was really a big theme in our conversation with her, is that sometimes the quest to fix the symptom actually ends up causing, paradoxically, more suffering than, because it stunts your growth, and you can get stuck in not living life because you're just in this, like, I'm just going to wait till this is fixed before I get on with life. And 20 years later you're still there.
No, yeah. If every aspect of who you are is trying to undo a pain experience, then, like, are you living? Are you actually living? Or are you just, or are you just suffering? And it's quite upsetting to think about, actually.
So Nick, sorry.
You go, Cloe.
Okay. It's like, I'll go first. You go first. So Nick, and I've seen this happening with your Instagram has gone more and more toward, and it was always about communication, and I feel like, though, and correct me if I'm wrong, it's gone more that way in the last however long. You're putting out some really incredible content around, why communication's important, some tips on how to communicate, etc. So that's obviously something, you're hugely passionate about and see as hugely valuable to the profession, and it's also hugely valuable to our profession as well, Pilates and etc. So you've now created a mentorship, which is around helping clinicians get better at communicating, right? Yeah, maybe I need to do it, because that didn't come out very easily.
All right, so. Oh, sorry. Before we get into that, the question I wanted to ask, which is kind of the same question, is like, okay, so if I'm a Pilates instructor and I'm, I've got some sort of individual, client, or maybe I'm teaching a group of 5 or 10 or 15 people, and there's someone in that mix somewhere who's got some kind of persistent pain problem, right? But maybe the format is such that, okay, they're not expecting to come and have a 45-minute conversation about the meaning of life. They're going to hop on the reformer and go, which exercise would you like me to start with? So how do I as a Pilates teacher, as a movement professional, how do I navigate that, how do I provide value to my client who wants to exercise, and that's why they paid me the money to be here today. How do we create opportunities for communication and empathy, and so that I guess that's why I think, okay, there's this clinician project that you're doing, this mentorship. So yeah, can you kind of walk us through that? And is this what the mentorship's for?
Yeah, I mean, the mentorship is very much it's more geared towards like clinicians in clinical life, but certainly the principles that are taught will apply to any relationship, any conversation that you might actually ever have, and so and that's just because human communication and connection are not different, right? Like, to connect well with somebody, it doesn't matter if you're talking to a loved one or a client. Like, I think the principles that underpin really good, effective communication are all the same. But it hadn't occurred to me that where things occur on a group level, like where you guys would be teaching to many people all at once, and so creating. That's a very fascinating thing, because in my world, like most of my practice is one-on-one, and I guess what I'd want to know from you is where do you see opportunities in your practice where communication could be better? Like where do you see opportunities there in like a studio setting?
Yeah, so I can jump in with that one.
Sure.
It's kind of my bread and butter, so to speak. So particularly the client with the persisting pain, etc., they are always up for a chat. There is always opportunity to chat at the beginning of class, before class starts. There might be opportunity to have a chat with them at reception. There is always, and they are the client that does want to have that, because they are also the client that may be more fearful of movement. They may be, they've had a journey with identifying with, it's my bad back, or it's my bad knee, or it's and this is their words, not mine. So there is absolutely, at the beginning, at the end of class, there is always, and it is that client that wants the chat. And I do believe that it's where and then there's opportunities throughout the class in order to use words that are affirming and that help to create a sense of fearless movement, whilst also feeling like they're being heard and seen. So there are touch points absolutely throughout class, and how the instructor is communicating with them and with the class as a whole. But there is definitely touch points for one-on-one at beginning, end, etc. Yeah.
Oh, that's awesome.
And also, I've had a lot of success when I was teaching group classes with just reaching out to people and texting them outside class.
Or email. Yep.
Yeah. Hey, Nick. I've been thinking about you.
Yeah.
And I've been thinking about what you told me about how your back's been hurting you for 4 years. And, if you're open, I'd love to have a chat with you. Would you mind, would you be open to coming in 10 minutes early, sometime in the next couple of weeks?
Raph.
Yeah, beautiful.
And people have been so grateful to receive. They've been like, oh my God, I can't believe you'd, reach out to me. It's like, people have always received that very well.
Yeah, I would use those sort of special moments that you can create before the class, like to just very create just a context where you're asking open-ended questions of people, like what do you want to know about how Pilates might be useful to you, and how can I better serve you in the context of your pain? What can I help you better understand about pain in general? Whatever it is, and then gathering their own expectations, and then just spending time throughout the class when they're doing certain movements, and perhaps poking into pain or whatever, trying to create experiential learning processes. And I'm sure you guys do this all the time.
Nick,
like you guys are.
double click,
Yeah.
Raph, I'm using one of your terms, double click. Can you just double click on poking into pain? Because people might be like, what the hell, poking into pain?
I just mean, well, all I mean by that is like moving into positions, postures, loads that may be triggering. But what I love about Pilates, even though I don't do it, but what I love about Pilates is there's so much opportunity for novelty in experiencing movement and not putting limits or bounds on what movement is or should be or how it's supposed to look or feel, and just encouraging people to try out novel, unique ways to learn that feel good to them, and not put any limits on what they're meant to experience or meant to feel or meant to look like. And then just following that up at the end of the class, like, how did that go? Like, what was that like for you? And did something surprise you? And then just using those as beautiful touch points for, just breaking down these preconceived notions about what healthcare is, what Pilates is, what we do, and then creating these immersive experiences that are very relaxing, very free flowing, and hopefully creating a positive experience on their pain, whether or not it changes it. And then elaborating a little bit more as they come to become curious, if they are curious, and then using that as an opportunity to potentially educate them on something they didn't know about. But the key part of any educational process is checking whether or not they get it, whether or not they actually understand what the hell they're saying or what you're saying. So having them teach it back to you, or, having them, say it in their own words, so that you can ensure that they actually understand that whatever learning happened sticks. And then the cherry on top of that might be, well, in your role, like saying, well, how are you going to approach maybe something in your life differently because of that? Like, is that going to mean something different for you tomorrow? And then just putting that little stamp on, like, okay, go do something different now. Like, this this isn't what you expected. Pain isn't always what you expected. And now go live differently, go act differently. And so these are all these beautiful areas in your own practice to create really effective, powerful dialogue between people, really effective communication. And it's almost more powerful in a group setting, because when people are moving and grooving together, like, it's awesome.
We spoke about this just yesterday, Raph, when you and I were recording. That I was saying exactly the same thing, Nick, that in all my years of teaching, the most success, if success is the right word to say, but I felt most helpful to my clients with persisting pain in a group setting as opposed to one-on-one, because what I found, this is just purely my experience within the one-on-one setting, they're more focused in on, every little thing, so, oh no, I feel that, oh no, this is my, like, it's the pain, whereas in the group setting, there's that they're buoyed on by, everyone around them, and the fun, and all of that, and it's,
different focus,
distraction, and so
it's a very it's such an innate human thing to do. Like, this transcends like cultures and time, where we do get together in groups and we do often move in unison, and there are so much evidence of historical ritualistic movement practices that were just incredible experiences. When people are moving in unison and together, it captures this essence that is so human and so us, and it does motivate us to be playful and have fun, and what that does for stress levels and the ability to relax and be experimental and be creative and feel good moving your body and experiencing the body that you're in. Like, there's so much power in that. And then I just love the idea of then coming together afterwards and making sense of it all, or trying to figure out why that was so great for somebody who maybe hadn't had that experience before. So I really think what you guys do and the setup that you have is really, really sweet. Maybe Move's got to steal some of that and apply it to my clinic somehow.
So tell us about your mentorship and who that's for and what it's for.
Yeah, it's for any movement or allied health professional who really wants to get serious about communication and connection. And if people think they're good communicators, that's usually a red flag to me. It's like, what does that even mean? It's just this, because communication is so emergent. Like, I don't know what I'm going to say 2 seconds from now, but it's an 8-week program that teaches principles, and every week touches on a different topic surrounding really the clinical world of communication, but it certainly transcends the clinical realm and can be applied to any health or movement-based practice in general. And so, yeah, it's meant for people who want to get serious about the power of communication. And I mean, there is immense power in everything we say. We have no idea what the words we say to another person can do for them to spiral them into chaos, or to uplift them, empower them, and redirect them towards the hope and towards the light that they desire. And Raph told a freaking story today where there was a miscommunication and he thought 12 months his face was going to be better, and it wasn't. And that was fucking distressing. And I saw a client today who was told that her ankle fracture, she was going to be dandy 6 weeks after the break. And she wasn't. And she was so stressed and so anxious and just a mess today. And so it's all these little nuances that happen that fire me up and just motivate me to create a space where practitioners can practice communication skills, learn, grow together, and become better overall emotionally intelligent practitioners, because that's, at the end of the day, what I think the world needs, and that's what healthcare needs. We're trying to just put the care back into healthcare through relationship-centered, effective, communication-oriented processes and care models. And so that's what I do. 8 weeks.
That's awesome.
Yeah.
I think, absolutely the communication thing is so powerful. And I can think of the other side of the coin as well, where I've had, a few times I've had the experience of people coming to me via DM on social media or whatever, and saying like, oh, I'll never forget, you influenced me so powerfully. This thing you said, I'll never forget when you said blah, blah, blah 5 years ago. I'm like, I've got no recollection of ever saying it must have just been some off-the-cuff, flippant, throwaway, and that's like it's had such a profound effect on somebody. And it's like, oh, what if I actually knew how to produce that effect more reliably? What if I could, what did I do? How do I do more of that? And so I think that's the other side of the coin, right? With the communication is we can really level up the positive effects that we're having.
Yeah, no, I truly believe every time you interact with another person is an opportunity to leave them better than you found them. And you don't necessarily need to do that. Like, yes, hands-on skills are fantastic, but I think there's so much more power in showing people and guiding them towards what they can do for themselves. Because, again, at the end of the day, they're the ones who create and do the change. Like, it's a famous quote, it's like, you can only change yourself. Like, you can't change anybody else. And so I don't think I do change anybody. I create insights. I help them find what's already within, like what's already there. Because people are smart. People know deep down, I think, what they need to do. They just need one, to be heard and understood. Because so often they're just invalidated, and it's tragic how much suffering just comes from invalidation, just not actually acknowledging what the person's going through. But then at the end of the day, like once they know that you're there, then you can work together and you can help them find solutions to the problems and help lead them towards what they want. And, you know, the body, the mind is awesome. It can change, and it will change if you create the right conditions for it.
Wow, what a great place to leave it.
Awesome chat. Thanks for coming on, Nick. That was really great.
Yeah, it was a lot of fun.